Did you know that a 2023 Harvard Medical School study revealed women over 60 who live alone face a shocking 47% higher risk of preventable health emergencies compared to those who live with others? Even more alarming, most of these emergencies could be avoided if you knew which everyday habits quietly put your health in danger. Researchers at Johns Hopkins followed more than 12,000 older women living alone for 5 years. They found a pattern that was impossible to ignore. These women weren't careless, they were strong, independent, and proud. But the same hidden behaviors kept appearing right before falls: sudden hospitalizations, medication problems, and loss of mobility. What's frightening is that these habits feel perfectly normal. Skipping meals because cooking feels exhausting. Ignoring dizziness because it just comes with age. Hiding memory slips so family members won't worry. Each choice seems harmless in the moment, yet together they create a dangerous chain reaction. Blood sugar swings wildly, bones weaken faster, muscles shrink, and the brain struggles under constant stress. When hospitals studied women admitted for preventable emergencies, the same habits kept showing up over and over. This video matters because it isn't about weakness. You're not weak. You're uninformed. And that can change. Today we'll go through 9 deadly mistakes older women living alone must avoid. From least to most dangerous. Stick around because mistake number 3 can quietly trigger rapid health decline, even when everything else seems fine. Before we dive in, here's a quick question. How old are you and where are you watching from? We read every comment and turned them into a shared safety journal for our community. Mistake 9, skipping a daily check-in. Living alone doesn't mean being isolated. But a University of Michigan study found that 68% of older women living independently go more than 72 hours without anyone checking on them, creating what emergency responders call a critical response gap. Without a check-in system, a simple slip in the shower could leave you on the floor for days. Minor injuries can become life-threatening, causing dehydration, blood clots, or organ failure. How to fix it? Send a morning text or emoji to a trusted friend. Make a short daily phone call during breakfast or coffee. Open and close the blinds at the same time each day so neighbors know you're up and moving. Use free apps that alert contacts if you don't check in. Consistency is key. Have multiple people who know to act if they don't hear from you. Studies show the first 24 hours after an emergency are crucial. Mistake 8. Hidden kitchen dangers harming your bones. Research from UCLA's Bone Health Institute shows that 71% of older women consume foods that weaken bones without realizing it, speeding up osteoporosis and increasing fracture risk. The biggest culprits: excess sodium from canned foods, processed meals, and even some breads and cheeses. High sodium makes your body excrete calcium, weakening bones. Carbonated drinks, even sugar-free, contain acids that pull calcium from bones. Drinking 1 diet soda daily increases fracture risk by 14%. Coffee. More than 3 cups per day reduces calcium absorption and increases calcium loss through urine. How to protect your bones. Pair coffee with calcium-rich foods. Replace half your sodas with water or calcium-fortified plant milk. Cook fresh meals and flavor with herbs instead of salt. Keep sodium under 1,500 milligrams daily. Mistake 7. Sleeping in positions that reduce oxygen flow. Northwestern University discovered that sleeping in the wrong position can reduce oxygen to your brain by up to 23%, causing slow, silent damage over time. Sleeping flat on your back with your head too high or too low can partially block your airway. Sleep apnea episodes can happen up to 30 times an hour without anyone noticing. Best sleeping position for women over 60. Lie on your left side. Elevate your head 4 to 6 inches with a wedge pillow. This improves oxygen flow to the brain, reduces acid reflux, helps your lymphatic system drain waste, and lowers your risk of glaucoma. Morning headaches, dry mouth, or feeling unusually tired can indicate your sleep position is harming your health. Mistake 6. Letting toxins accumulate in your home. Older women living alone are exposed to 3.5 times more indoor toxins than those living with others, according to environmental health research. Hidden toxins include plug-in air fresheners that release chemicals disrupting hormones, scented candles that release tiny particles causing chronic inflammation, old carpets that contain pesticides, flame retardants, and heavy metals, non-stick cookware that releases harmful compounds when overheated. How to reduce exposure. Open windows for 15 minutes twice a day. Replace air fresheners with activated charcoal or natural alternatives. Vacuum twice a week using a HEPA filter. Slowly replace nonstick cookware with stainless steel or cast iron. Mistake 5. Mismanaging medications. A study in the Journal of American Geriatrics found that 82% of older women take medications incorrectly, reducing benefits or creating dangerous interactions. Common examples. Thyroid medication taken with coffee loses 40% effectiveness. Calcium blocks absorption of antibiotics. Painkillers with blood pressure medication increase kidney strain and stroke risk. Grapefruit juice can triple the level of certain drugs in the blood. Solutions. Make a complete schedule for all medications and supplements. Have a pharmacist review it. Use a weekly pill organizer and alarms to keep track. Mistake 4. Ignoring early warning signs. Mount Sinai hospitals found that 79% of older women ignored warning symptoms for days or weeks before a serious event. Sudden confusion could be a mini-stroke. Extreme fatigue may indicate heart failure. A persistent cough can signal lung disease or cancer. Changes in bathroom habits could be early diabetes or urinary tract issues. Fix it. Track symptoms daily. Note severity and decide when to call a doctor or go to the ER. Red flags. Sudden weakness, severe headaches, chest pressure, shortness of breath, vision changes or disorientation. Mistake 3. Creating barriers that block escape. Fire safety reports show that 67% of preventable deaths occur because women couldn't safely leave their homes, not because of the original emergency. Clutter, furniture, and rugs can become hazards. Women over 60 need 50% more space to navigate safely. But most homes have 30% less, making emergencies more dangerous. How to stay safe. Keep at least 36 inches of clear path from your bed to 2 exits. Remove clutter and obstacles. Add LED nightlights along pathways. Practice escape routes monthly so your body knows what to do in the dark. Mistake 2. Social isolation. Harvard's 85-year study found that social isolation is as harmful as smoking 15 cigarettes a day, increasing early death risk by 50%. It's not just being alone, it's the lack of meaningful connections. Isolation can shrink brain gray matter, increase stress hormones by 34%, weaken immunity, and speed cognitive decline. Ways to stay connected. Join weekly book clubs or volunteer. Set regular coffee or lunch dates. Aim for at least 3 hours of meaningful social contact weekly. Meaningful conversations, sharing feelings, debating ideas, or working together, stimulate the brain and help maintain memory and executive function. Mistake 1. Ignoring fall prevention. Stanford trauma research shows that women over 65 living alone have a 312% higher risk of dying from a fall at home than from cancer, heart disease, or stroke combined. After a hip fracture, 21% chance of dying within 30 days, 50% chance of losing independent walking ability, 80% chance of needing a nursing home within a year. Prevent falls with grab bars in the shower and near the toilet, non-slip strips in tubs, remove throw rugs, nightlights with motion sensors in all rooms, raise toilet seats with risers, keep phones in every room, wear non-slip shoes indoors. The cost, $500 to $2,000, is tiny compared to the $35,000 treatment for a hip fracture, and it protects your independence. Conclusion. Living alone as an older woman can be safe, independent, and fulfilling, but only if you take these 9 mistakes seriously. Start with small changes, order a grab bar, set up a daily check-in, adjust your sleep position, or declutter your escape routes. Each action lowers your risk and protects your independence. If this video opened your eyes to dangers in your home, subscribe for more life-saving tips, and share it with any older woman who needs this advice. Taking action today could save your life and independence tomorrow.